Welcome to the Radiate Wellness Podcast. I'm your host, Christy Clemens Hoffman. Each week we will discuss tools, tips, and ways to radiate your best life ever, interviewing practitioners, authors, and luminaries to help you on your path. Wellness, joy, peace, abundance. What do you want to radiate? All right, hi. We are here tonight with Alex Jackson, who's one of the owners of Centered Spirit, which is where this office is, and one of the practitioners that we work with. So, hi, Alex. How are you doing?
I'm doing great, thanks.
Good,
Yeah.
Good. It's nice to see. I'm glad you could come out. So, you do a pretty particular type of massage.
Sure, yes.
Plus other things.
Plus other things, yeah.
Plus other things. So tell us a little bit about what it is you do. The abdominal massage, and it's traditional Mayan medicine as well.
Traditional Mayan medicine, yeah. And one of the fortes of traditional Mayan medicine is an traditional or abdominal massage, Maya Abdominal Massage technique, which I've learned over the years and over the last 16 years now, worked with. Traditional Mayan medicine covers many bases as far as historically use acupuncture, use acupressure, use cupping therapy, uses herbs, uses just helping people with the emotional but also the physical body elements as well, combining both together, using simple but effective techniques. And one of the most simple but effective techniques that I really had picked up and drew me into more traditional Maya medicine approaches and wanting to learn more was the Maya Abdominal Massage.
Yeah. Right. It was that your gateway into all of this?
That was really it. It really, I could see that so many things could be addressed, so many things could be treated, so many things. It was kind of the avenue to our soul or spirit, but also reproductively, digestively, cardiovascular system, lymphatic system, reproductive. Everything is centered here. So you really can make huge changes with someone in some things with simple but effective techniques, and then combining some other things, understanding about how the body and emotional things work. And to me, that was the key to and usefulness to be able to perpetuate me on kind of a career of learning more about it.
Right. Yeah. So you said you've been doing it 16 years.
Yeah.
So why abdominal massage? Why Mayan medicine? Why that?
Well,
so
I mean, I started out in massage therapy for a few years, and I wanted something a little longer, longer lineage, and so I stumbled upon Maya Abdominal Massage, and it was something that I didn't really know what I was getting into, I don't think, at the beginning.
Right.
Some of it was dealing with menstrual uterine displaced, just hipped uterus, and then massage, and I don't remember even thinking too much about that then, and digestively and everything. But once I took the training, took the course originally in the Arvigo techniques of my abdominal therapy, the simplicity but the effectiveness and seeing so many conditions that were treated, be able to treat for it with women that had painful periods for so many years, and been able to do an external massage to adjust that, to help with that, or fertility issues, or fibroid cysts, digestive disorders also, whether it's IBS or constipation or post-surgical issues, anxiety, stress, and all these things that are combining together. And when you're coming back from a training and you see that you're the only one here at the moment doing this, you go, wow, people need to know about it, and I need to know more about it, and I need to learn more, and I need to go back to Belize, I need to go back to Guatemala, I need to go back to Mexico to learn more from the traditional healers that are there. And it became something that, knowing that not a lot of people work in their abdomen. We get massage, we get body work, we get some type of work on our back, our shoulders, our neck when it gets tight or sore. But it's one of those areas that are always overlooked whenever we don't actually get someone to work in that area to
Yeah, we
alleviate pressure
don't.
or I mean, we feel when it gets to digest, when we get discomfort or when something doesn't work, but we don't really know what that awareness is like. And it's one of those vulnerable areas. It's socially uncomfortable sometimes. And yet, so to bring people to a comfortable state, to a state of acceptance, to a state of what it needs to be in health related wise and emotionally, where we store a lot of stress, we store a lot of anxiety and tension also, and to open that area up is a beautiful thing, and where we almost have the most direct access to health, I think sometimes, is from our core out, not just from the outside in. So from the inside out, it's that adage that we heal from the inside out, and nothing kind of works better to diagnose, to treat, and everything from, digestively speaking, or we try to eat food right, but how are we actually feeling inside? And so anyway, my abdominal massage has been, and abdominal work has been sort of an avenue or a key that I've focused on, because when I feel that it's in balance, everything else just becomes much easier in life. And that's how we kind of named our place Centered Spirit over the years. Just when the spirit is centered, everything else becomes easier, I think.
Right, everything else kind of flows from it. Yeah. And so you mentioned Belize, Mexico. Where else did you study? Guatemala? Mm-hmm. Oh my gosh. Is this traditional Mayan massage, is that more prevalent in those countries? Where did it develop?
Yeah, it is ingrained in the culture as far as traditional medicine goes there. Over the years, and I've talked to many people too that have gone down to Mexico and had from traditional healers these types of massage. In fact, one of my mentors, Rosita, had learned from her traditional healer down there, and that's one thing that she picked up these techniques from. From an ancient shaman down in Belize. So it's known and it's useful, and even the circles of midwifery that are down there and traditional medicine. One of the lost arts that is coming back and forward, back again now. But it's not only in there, but it's almost necessary for healers and village people to take care of themselves by these methods, and they're not. We don't need sometimes the invasive procedures or surgery. It's just about getting in there and working in the body and helping it and having some understanding of how everything connects. So yeah.
Oh yeah, absolutely. So you talked about this being a very vulnerable area of the body. I mean, it is. It's the one part of the body that doesn't have any bone structure in it. It's not protected at all, and then there's so many vital things that happen there.
Yeah.
So yeah, it's very vulnerable.
Yeah, it's interesting you mentioned that, because I used to use that quite a bit. I used to say, this part has no bony structure. I would actually say that. So, and I think people don't work on it a lot. They get they're not trained properly sometimes in types of massage therapists, even in school.
Right.
So when someone goes to get a massage or body work, they may not receive it the right way, or have someone who's trained properly in it, because we look at it as muscles and bones and the body. That's how we teach a lot of massage techniques. We don't teach it as far as fascial tissue, holding organ placement, what runs through there, and that's living, breathing back at you. It's got a different rhythm to it because of that emotional connection and how our diaphragmatic breath works through there, and and everybody holds a different sort of history there because of where we store our stress, where we store our abilities of traumas or stresses through life. We contain things, so it becomes that, and so as we work with someone, we want to make sure that they feel the difference, and at the same time feel safe as they're working in that area, because it is an open space, and part of the treatments is helping people understand what they're feeling, what they're connecting to.
Well, you can even tell just by our language when we have butterflies in our stomach.
Exactly.
Right? Stress eating. We all know that our digestion slows down when we're under stress, or it speeds up for some people according to stress. So we do hold a lot of emotion there, and even when we're under stress or we feel like we've received some really shocking news, we just kind of hold our stomach and go, oh my God.
Yeah.
There's that response. It's just the word visceral comes from our viscera, right? It's a visceral, guttural type of response that we have, that we store so much there. Yeah.
And if we did the same thing, if we went to go notice those responses in our neck, we would go get probably a massage, or we would get some type of energy work, Reiki, or something worked on in some ways.
We would.
And we kind of do it a little bit and rub like you said, hold our gut or hold our stomach in the right way or hold our breath. But when it gets sustained or for such a long period of time or never gets unwound out, that's when we start to see the kind of pathological disorders or something or chronically develop over time. And that's what we want to avoid or try to get people to connect to in a way or alleviate from in this area. Because that then can radiate through the whole system, whether there's nerves or muscles or back pain or headaches even. Even headaches come from the abdomen, believe it or not.
Yeah, no, I believe that because I'm a meditation instructor, Reiki master, so I'm versed in the vagal nerve and all the things that it does when we're under stress. It shuts down to allow us for fight, flight, or freeze reactions.
Exactly.
And there's a lot of physiological changes that happen when the vagal nerve is interrupted. So we see all kinds of things like that. And headaches, vision changes, ringing in the ears, many different things are responsible on that pathway. So it's just restoring that balance. And the breath, absolutely, the breath. We need to be able to draw it down into the belly. We can't if we're tensed up, tied up in the belly. The breath is life.
Exactly.
And digestion, we all feel better when we're digesting our food properly. So when that shuts down, it causes a lot of problems.
Breathing is key, and people think that we can. Our bodies are very resilient. We can operate on very small amounts of breath. So most people are walking around and functioning to a degree that is what they feel is normal. But when we actually are able to work within this area of the body and open up those diaphragms, it takes the pressure off the system and lets it function like it's supposed to, cardiovascular wise, lymphatic wise, reproductive wise. Everything functions much better. Circulatory wise, energy improves, function to all the organs improve, hormonal balance improves. So even if someone has is having menstrual issues or fertility, those chances improve with their cycles. Digestively speaking, or even just emotionally, everything is compounded in that pressure system of our breathing. So it becomes where we sleep better even.
Right.
We have to breathe to sleep, which is, people don't realize sometimes that, they watch a baby's breath go up and down. Their belly just moves up and down very effortlessly, but they need to do that to sleep, not just to play or have energy throughout the day, or we don't. We also need to breathe to sleep. So that's one thing to look at even for sleeping,
Yeah, that's fantastic. So we talked about you've been doing this for 16 years, and I want to go back to something you said. You said you just stumbled on this. How do you stumble onto traditional Mayan medicine in Kansas City in the Midwest?
I was doing massage therapy, and I picked up a Massage and Bodywork magazine, and I had it had a picture of an abdominal massage, it said on it, and a picture of an abdomen, and 3 types of, one I can't remember the type, but the other 2 was Chene Song therapy, which is the Taoist version of Qigong applied bodywork on the abdomen. And I've taken a few courses in it as well, out in the San Francisco area. But the one that I started first and resonated with me, and I was the Maya Abdominal Massage, an article that had been written in there. And probably within 6 months of reading it, I signed up and took the class, and then became certified as a teacher and spiritual healer, and all these things. Kind of wanted to know as much as I could, but and that's how I stumbled on it. It was on the cover. It was in a magazine. It was in a magazine, and the path was meant to be. So it changed my practice, changed my life, changed my focus on what I do, and perpetuated me into be able to be able to make some shifts, and I wanted to dedicate my practice after that, to everybody that I'd see to come for that. It took a while,
Right.
but afterwards,
Absolutely.
after writing articles and getting people aware, it became more known of their other how beneficial it was, what the results were, how we can educate people on it. So in the Midwest here, because at the beginning I was the only one doing it here. So now there are a few other people that do it, and at the same time, to different levels, different degrees. Of course, we all bring our own thing to it, but at the same time, we just need people to know that it's available. Yeah.
Oh, absolutely. It really is a niche for you.
Yes.
There are a couple of others doing it. I wasn't aware of that, but for the longest time, you've been known as what around here?
I don't know, abdominal massage, uterus. I don't know. There's been some other. There's probably been some. I don't know. There's probably.
I remember you
been
saying
some
one time in a presentation that I'm known as the uterus guy.
Yeah, there was that too. There used to be. I haven't heard in a while, but the first few years, I remember that it was probably some of that. Yeah.
Yeah, absolutely.
Yeah.
So I know that you've kind of specialized
fun.
in things like fertility. So I know I've seen you for that years and years ago. That's how I first became aware of your work. I ended up adopting, and we did not conceive, but I know that you were known in that circle, if you would. Fertility is a big thing. A lot of people are very interested in it.
Yeah.
So how did you really get to specialize in fertility and women's problems? I know it's kind of part and parcel, but is there more to that story?
Well, it's one of the things that this work does with, one thing I love about the traditional Mayan medicine, the Maya Abdominal Massage, I never get bored.
Right.
It allows me to treat many conditions.
Absolutely.
And normally I think we would go in our specialized fields and say, okay, I only do fertility, or I only do back pain, or I only do digestive. And in traditional medicine, they're all interrelated to each other, and so the training of how and the uterus gets tilted, how to actually do the massage to help with the conditions and putting it in the right position, alleviate congestion there, increasing hormonal flow, activity.
Right.
All of that is the more that we can actually have the menstrual cycle, the healthier it can be. The more odds are in our favor for putting fertility chances in there. And so we've been able to see pregnancies happen and help people achieve pregnancy where they're having before, see the cycles get healthier and healthier, which then achieves pregnancy, where some of the things don't show up on tests. There may be a trauma involved, there may be something else involved that may not show congestion in that area or protection, or a long-standing history of endometriosis,
scar tissue,
some adhesions, and some of the adhesions develop. So it's just one of the things that we treat, and sometimes it might be chronic pelvic pain may be related to it. So that's another big thing, and chronic pelvic pain may be an issue that if there's someone having pain, it's going to be very hard to achieve pregnancy. So when we address chronic pelvic pain, a lower pelvis, through the massage techniques and through the traditional Mayan medicine techniques, we can then try to also alleviate some of the congestion and for fertility. There might be a digestive problem too. So all of it is interrelated.
Yeah, absolutely.
And that's what I love about it. So fertility just became one of the facets that we work with, and I love to be able to be one of those people that looks at the things that not everybody has looked at, and hopefully been the answer or been help us find putting that piece of puzzle together that people haven't seen yet. And sometimes that really does make a difference, because if people are frustrated sometimes and they come in and they are looking for just a simple answer that they can understand more of.
But a lot of these issues, digestion, fertility, adhesions, that type of thing, but it's not in a vacuum. Many times it's all kind of lumped in together, because we've only got this much area of the body to work with. And for those of you who are not watching right now, I'm pointing to specifically the gut. We only have so much area to work with.
Yeah, it's our area almost from our clavicle or collarbone. I say the abdomen goes there throughout the chest almost, because you've got your rib cage, which is your
breath.
Also your breath, diaphragm, so all the way down to your pelvic bone. But then again, that area where there's no bony structure, where we kind of call our stomach, if you will, that's area 2, and so we're used to also dividing all that area up. So someone goes for
you go to a digestive like an endo
doctor, then they go to the reproductive medicine doctor, and they go to someone for back pain, and they go to someone also for musculoskeletal. So there's 3 or 4 people, and sometimes they may have stress or something else going on, so they go to massage, and they go to the counselor. But none of these people can talk to each other.
Exactly.
Or have talked to each other. So even going to massage, they can't. They can't. Therapists can't talk to them. Or if they're going to a counselor, they can't touch them. If they go to we go to digestive, they're certainly not going to talk to their reproductive endocrinologist or their OBGYN, even if some of their reflux and their diaphragm may be so tight that it may be blocking some of the hormones that are getting to the uterus. So we should be talking to each other. We should be doing something with each other, but we're not in some ways. And so, but what I look at is the whole picture there, because it's so connected. And so, like you say, so close to each other that it just makes sense that we should address it all at one time.
Right, absolutely. Now, from an energetic standpoint, because that's what I do as a Reiki master, hypnotherapist, medium, I'm looking at the energy system, and so much of that is tied up together. So we store our emotions in our solar plexus chakra and the sacral chakra. Of course, you do Reiki too as well. It's not your forefront, but you don't lead with it. But we see these things tied up in emotion, we tie it up in thoughts, tied up in our beliefs. And in our energetic system, of course, over time, then it starts to go to the physical system. So that's where I feel like our work kind of informs and passes off to each other. So I like that we can talk, even though some of the medical professions, the specialists don't talk to each other. But we can talk to each other as far as what's going on physically, what's going on energetically, what's going on emotionally. I know that sometimes I hear some interesting sounds coming out of your room.
I can't hear those. Come on, there's no problem.
But, when I'm here, I'm like, oh my gosh, what is Alex doing to these people in his office? So, they're releasing emotion, releasing pent-up trauma.
Yeah, sometimes, we think that we're big containers a lot of times, and as containers, like anything, can only take so much water as we fill a jug full or a plastic bottle before it kind of bursts, if you will. And that's not good for our physiological body. And what happens is when we work, especially in the abdomen, as we know, we store those butterflies there, those are too. So our bodies recognize that there's something there, but we never really have that opportunity because we go to work every day, we got your families, we got everything, to just be in a safe environment, to be in a place where we can just unwind, let go, and given the opportunity, our body recognizes that, our energetic body, everything recognizes that. And so it really, part of that is that emotional release. It happens more in the abdomen sometimes, but that just as that happens, the physical body also unwinds it out in a way that where something may have been stuck, as soon as that just emotion happens that recognizes where it came from, it melts it away. And that's where healing really happens, because then we don't feel like we're just so weighted down in a lot of ways and never have an opportunity. A lot of times we know this cognitively, but a lot of times we don't want to be a burden on someone. We don't want to be, we've gotten to a place where we've learned how to cope with things in a way, but our body, again, is telling us different. It's like there's something that isn't connected here. So we try to connect that back to where it can just go. And sometimes it becomes emotive in a release that sometimes tears are emotion, laughing is an emotion. All things we store there. So the body recognizes that.
It
so
really does.
Some of the job by just working in this area, some of the job then becomes that sort of holding that space for the person
Right.
to have that opportunity, if necessary, to help them, guide them through that process.
Just even telling them it's okay.
It's okay that they feel, because sometimes we also think that we're embarrassed, or we feel like we shouldn't do things like that. But as long as we feel we listen to our body and allow it to, it responds accordingly, and we get better at it. We get better at and knowing what it needs.
Yeah, absolutely.
Yeah.
Yeah, and I know in a Reiki session too, people will emote.
Yeah.
People will release things.
Yeah.
Even just stomach gurgling that happens when the energy starts moving.
Yeah.
And then people will sigh. People will yawn. Things will come up memory-wise, emotion-wise. That's buried down there in the energy system and in the physical body too. Right.
Yes.
So it's really pretty fascinating when you talk about emotions, things that are so intangible, actually being in the tissues, actually being in the energy system. It's fascinating the way we work. So you've been doing this for a while. You started with massage, going to the traditional Mayan stuff. You also said you do cupping, and then you said there were some other things involved with this. What else is involved besides massage?
Well, I also try what we'd call in traditional Mayan medicine and stuff. We refer to someone as a practica, which is basically a heart-to-heart talk.
Oh, right.
When you go in and you get to know a little bit more about what the person is, and that session's about a half hour to 40 minutes, and so it's about a 6-page questionnaire we go over to learn a little bit more about the person. So we want to know not just dietary, not just medical, but also reproductively speaking. We also want to know some of their past history about family history, even emotional and support. What's going on in someone's life? So that's just the traditional healer part of getting to know the individual, their spirit. Looking in their eyes, listening to them, where they're at. And then we use techniques as far as, I use cupping therapy, or ventosas we call it also. So that's...
Okay, for people who don't know what cupping therapy is, can you go into that a little bit?
So cupping therapy, I use fire cupping or ventosas. And that basically is taking a glass and a heated element to that heated vapor puts a vacuum in the glass, and then you apply it to the body, which creates like a suction, and you leave it there. And in Chinese medicine, they leave it there for a longer time, which creates like a purple almost circle on the body, which creates toxins to come out. And in my medicine, what we do is move it around quite a bit. So we move it so you don't leave that purple circle really around you, but you still get the pulling. Instead of, imagine almost pushing, when someone's pushing on your body for a massage, except under this, you're pulling the tissue. So you're pulling the skin a little bit, almost like a vacuum, which then, as you can see, would pull all that congestion and nerves in a nice way around that. So it really helps to bring oxygen to the tissues a lot quicker, and really is where there's kind of heaves or jump start, where there's just kind of everything is kind of adhered to each other in a way. So you use that techniques as far as all Moxibustion, which is another form of helping with mugwort. Basically, it's an herb to help with
So tell more about this. Moxibustion. Right.
So sometimes we'll do points, certain points that relate to congested areas, or maybe the liver or spleen, or different areas in the body to help move energy, move congestion around. This herb helps to cause a warming effect and also deep penetration within that zone.
Are you talking the herb, the mugwort?
Yes.
Mugwort. Now, we had Janet Lee, also a practitioner at Centered Spirit, who does Chinese medicine, traditional Chinese medicine. That was another one of our interviews that we did. And she also talked about Moxibustion. So I know it works very similarly. So is it also with a kind of a charcoal stick?
Yeah, charcoal stick, sometimes powdered form. I have a box too. I can do it on the back, so it's a whole So there's different methods that you could apply
similar,
it to. Yeah,
but
you could each person or method does different ways. They maybe learned it, but the principles are similar. of
Right,
what they
exactly.
do, what they do. And
so stimulating circulation.
stimulating chi and the flow of energy and getting things to move in a better way, and also getting that deep heat back in the body sometimes where there's stagnation and cold in it too.
Yeah.
And that does help with that as well. And then we also, we bring back herbs. I used to bring back some herbs from Mexico and Belize, and we have them here, and we also use those formulas too for people that are, for anywhere from anxiety, stress to reproduction, to menstrual related issues, to digestive and things like that, musculoskeletal.
So you use these herbs like in teas or in wraps?
We have teas and also tinctures.
Tinctures, okay.
Yeah, teas and tinctures as well.
Yeah, and those are available for purchase here.
Yes.
And so if anybody was interested, anybody who's listening to this podcast, if they're interested in that type of thing, could they get in touch with you about it?
Yes.
Yeah, absolutely. So we'll put Alex's contact information in the show notes, and in the links we'll provide some links. Yeah. So you sell these herbs as well.
Yeah, they're going to be on our website, and so
on the website, good.
And too. So
we'll provide that information in the show notes.
So they'll be here, I think, at 2, and we have them available. If we have any questions on them, they're all sourced from rainforest or from different herbs in Mexico that we trust and believe in, stuff like that too.
Good. You have a lot of contacts down there.
Yes, and we can still go back to Mexico almost once a year to study and teach and with different various people. One of them that's studied with the Temazcal, which is another therapy in sauna therapy down there, and also traditional medicine, Rita, and in University of New Mexico as well in traditional medicine.
Wow, that's cool. Yeah, it seems like you're always traveling, always studying, always adding to your base of knowledge. You're pretty well versed in the traditional healing community, really, elsewhere, outside of Kansas City even.
Yes, and our goal is to bring it, to people that are, needing it, and at the same time, people are looking for something that they can connect with. It's not about just being woo-woo and being something that sits traditional. These are conditions that we treat. As you know, they're people that have everyday health conditions that people see every day, and some are more chronic, some are more withstanding that we would almost only know in our mindset sometimes growing up, and some cases that would be a medical related, if we call that. But since we're able to work with that in a way, we've bridged some gaps and made some partnerships within the communities to help people understand, and in allopathic medicine as well, that there is a nice bridge that we can connect with traditional and conventional medicine.
Yeah, that's something I really have always liked about your practice, is that you're very educational. Yeah. You're working on forming relationships between different healing modalities and educating about how they can work together. Yeah. And so that's something I've always appreciated about your practice. Always writing, always blogging, and informing people about that. So I think that's important. We can't just show up for healing and not know anything about it. It's like, okay, heal me. We need to be participating in our healing, right? We need to be, because it's all very personal and very individual.
Yeah, and there's there's a lot of choices out here, and there's a lot of places to go, and we're not trying to replace anything, but basically we want to make people know what's aware of everything, what they're doing.
Absolutely.
So that they are informed correctly, they have choices, maybe things they haven't heard of,
right,
or maybe things that no one's presented them yet for their healthcare, and then they can make a better choice of what works for them in that aspect. I may not be try to be the solution to a lot of things if I can, but if we're not the solution, then we're going to provide things or information with people that may be the solution somewhere else or somewhere in that frame, whatever we know, because that's the goal, at least, to empower people the more they can. And as we move into the next year, we're also going to be able to teach more classes here at the center and everything like that too. So
yeah, what are you planning on teaching coming up?
We're gonna teach. I'm gonna teach classes for the Awareness is Healing Institute that we've created, which is going to be focused on traditional Mayan medicine practices. So we'll have classes that are going to be anywhere from prenatal, working with prenatal massage techniques in Mayan medicine,
Great.
to also Maya Abdominal Massage techniques.
Right.
So we're going to do a 3-part series with the diaphragms, so respiratory, core related, and then pelvic diaphragm, and then putting it all together, which will encompass the emotional, it'll encompass the herbs, it'll encompass conditions treated, and also the applications how we treat in each phase of this, and how we put it all together. So that's going to be a big one coming up in the next year.
So you're going to be training practitioners?
We're going to do both. We're going to do practitioners, careers, and then I know there's some techniques we can do for people who are everyday people who aren't practitioners as well. They just need some basic self-care and basic knowledge on creating awareness about how they can help themselves understand a little bit more, where we can be a key for how to work with their own families, how to work with their friends in a way too. And certainly there's a degree where a practitioner level is needed, as far as just having that comfort and establishment to work and with a license on people and things like that too. But we're gonna try to bridge some gaps there with people into the next year.
Yeah, good. Yeah. So what else is coming up for you? And is there anything else?
That's the big thing. That's the big thing that we have. We've been working on this for a few years now, and I'm really to kind of get out there and teach more and create more, so people can learn more techniques and help within their own communities more, and people can help with that too. And we can do more mentoring programs. We're going to probably have a mentoring program as well.
For practitioners?
So, yes, for practitioners. Great. And also we'll even teach cupping classes, and those. So there's a lot of elements around that traditional medicine that we're going to bring forward. I know everybody isn't going to Mexico every year like we have, or going down to Belize or whatever. So a lot of it is part of the center that we work in and created is to bring these accessible to everybody. And that's the goal, at least, to bring it more accessible and everything like that too. We just got, and the University of New Mexico has done a great job with that too, and making some books and online courses with that too.
So you said the University of New Mexico?
Yep, University of New Mexico.
So the University of New Mexico is teaching some of these traditional Mayan.
They're doing traditional medicine, and we called curanderismo or traditional healing from the Mexico and the Southwest. So they put on a course every summer, and they've actually put out some books that that I'm in as well, with some of the books as well. So you're
quoted and cited in some of the healing
in the books,
training books.
Yeah,
right.
So it's great. It's a great resource as we want to bring this medicine more available to the United States, to the world, and everything like that too. And knowing that it's still available, that we're really happy that the universities are actually recognizing it and
That's exciting.
And actually printing material and chronological or putting it together in a way that is very resource oriented and legitimized. Yes.
Yeah.
So,
and so is this type of training, I know it's not very prevalent here in the Midwest and here in Kansas City specifically, but other parts of the country, is that catching on?
I mean, I think some of the other countries have more retreat centers where people are used to going to retreat centers and stuff. And I think it's going to catch on here more.
It is catching on, I think.
Hopefully we can be part of that change in the next few years as we develop it and everything going, and get people drawn in here more for more trainings and things like that too. But I'm happy to be into the loop of even in things that are happening in my home state in my hometown of Albuquerque and in New Mexico, which when I grew up there, I had no idea this was going on. This would be my path. But it's funny how it took me from New Mexico back to from Kansas City and then back. But through that, I had to go through Belize to Guatemala to Mexico to go back to New Mexico to realize that traditional medicine, healings in this way, and working with many ailments in the way that we do to be a lasting solution is being worked on and being done and being promoted still. I mean, so it's really kind of makes me feel very good in my heart to know that there's these things happening within Kansas City, within the world, but also in New Mexico, and throughout what we're doing. Yeah.
I keep forgetting that you're from New Mexico originally.
Yeah.
Right. What brought you to Kansas City?
Whole career, probably I was in retail management, and I was we're 20 years ago, so I've been here about 20 years. It's kind of interesting.
Retail management, like Abercrombie and Fitch, The Gap, something like that?
Home Depot, if you can believe it or not.
Home Depot, really? Awesome.
Yeah, I can't build anything to save my life, but I can work on bodies and people and help with them out, and that's so. I wish I could be more handy around the house and build something that direction. But my forte. I found it now, and
you
so
absolutely have.
That's the key.
It's the nuts and bolts of the body.
Yeah, nuts and bolts of the body. Yeah,
absolutely.
Building sheetrock and stuff. No, I'm not going to do that.
I'm always.
I think.
Right, I'm always interested in how people got to what they're doing and came from retail. I had no idea. I mean, I've known you for a while now. I had no idea you came from retail.
It got me out of Albuquerque. I lived in St. Louis for a couple of years, opened that market up, and came to Kansas City. And it just wasn't after as I was doing that, I knew something wasn't moving forward like I wanted to anymore with that company. And I looked and I took a massage course, and it was the most natural thing that ever came to me. I just knew it right away. I knew it right away. I could see my hands, everything. I just had this intuitive part of me that just knew what to do without thinking about it, without even trying to be, to think too much about anything. And so I'd see other people ask questions, or I saw people do this, and me, it was so intuitive that I signed up and I was like, I gotta know how to do all this. So I put myself through school, and I did everything for the massage part of it, training, energy work, and I got immersed in energy work and massage and everything, and so that became my shift.
And then picked up a magazine, and
I
fell into your...
I have a holistic health center and all this stuff now, years later. Amazing. So it's, one thing leads the other sometimes, and now we're here together. All right?
Yeah.
Working on bellies, rubbing bellies for a living, or whatever.
Yeah, exactly. Massaging colons.
Or colons and all that stuff too. Yeah. Talking about stuff that people never thought about. Yeah.
Yeah, right. I know you work mostly on women. That kind of is another question I had. I know you work mostly on women and reproductive issues. Do you have many men clients? Do they come to you?
I do have some men clients, and I think that number is increasing some, and I think by just the way we're wired in some ways, it's easier for women to connect to that self-care emotional state, if you will, and
women
everything.
get it in some ways more than men.
Therefore, it's just going to, by the numbers, going to be more women are going to come in or seek that health care. But I'm always happy when I get a male client and that comes in and they're really able to process or see what's going on and adapt to the and so that is changing more. I think even our society, we're getting more in tune with how we take care of ourselves better. So it is getting more and more.
So what might men come to see you for as opposed to women?
They may have digestive.
Sure,
more digestive
absolutely.
issues, stress-related, digestive. Right. Sometimes musculoskeletal, nervous, anxiety is one of the things too. Swollen prostate as well.
Oh, you can treat that? Or you can work on that?
Yeah, so we don't do any internal work for that.
Right.
But in the same way as the reproductive organs in women, where there's congestion or tension around the lower pelvis. Well, like anything, you have to get circulation to that target organ, and if it's blocked, you're going to get inflammation. So if we can reduce some of the congestion in the abdomen, we can reduce some of the inflammation heading to that target organ or the prostate as well, or pain in that area.
Interesting.
Some post-surgical adhesions, so if someone's had let's say a gallbladder removal, they've had a colon remove, or having something like that too. So I see women for that too as well. So, yeah.
Like gastric bypass too. Do you work with a lot of people with that?
I have worked with some of that. So yeah.
Because you can get scar tissue, adhesions, that type of thing. Yeah. So really, equal access. Everybody's got an abdomen.
Yes. Yes.
Everybody has digestion. Everybody has,
And the most prevalent time is after sometimes women have to have like the cesarean birth, or they may have to have, or we may sometimes have appendix or gallbladder removal or something like that too. So that scar tissue it may not show up having any trouble within the first few months, but those adhesions can get tighter and tighter, and then they may develop something over the next year or so. But yet nothing is usually recommended by the physician to go have massage or anything done in that area usually afterwards. But yet, so if we can get them in and work on that, it solves a lot of conditions that may be developed later, or if they've had withstand already, we can still work with that as well, even if they've had it for many years, to keep them feeling better.
Yeah, I mean, it's really a good partnership with allopathic type of treatments and medicine. It seems to go along very well with it because, allopaths know that there's adhesions, they know about scarring, they know about fertility, they know about all of this stuff, but they might not necessarily do anything about scar tissue.
Yeah, and we've had some great physicians that have been referred, some people here where they've had, in fact, where women have had, let's say, a cesarean birth, and they've had some scar tissue, very nerve pain that has developed from that, and very in tune with the physician then referred them here, and we were able to get them relief where the physician just didn't have that in his repertoire to do in a way, and I was able to kind of get that relief for them, which. Then they were so excited because then they didn't have the nerve pain every day. They could pick up their kids, they could play, they could do things where before they were just in so much pain.
Oh, yeah, that can cause a lot of tremendous amount of pain. And then, some of the more maybe traditional or allopathic solutions may be more surgery.
Yeah, they put more mesh in to do more surgery and everything.
Which causes more scar tissue.
Exactly.
And more adhesions.
I had one lady that probably saw a few months ago, and she was geared up to have the surgery, came in and had so thankful she came in because when she was able to cancel the surgery, because she was amazing, because after one thing she got relief, and she was so amazed that there was no other options. She didn't know there was going to be able to do anything for her, but she came in I think twice just to make sure it stayed, and she said, "This is." After twice, I have no pain. I can't believe it. I have no pain. She's like, there's nothing here. They don't need to do this. They put mesh in me now.
Isn't that great?
So that's what we want. We want to be able to help people just get those lasting changes. So find lasting solutions, and that's really what I love about what I do the most is seeing people transform, seeing people shift, transform. Making these changes in a way that they may have had something for 20 years, 30 years, sometimes chronically, and I get their frustration, I get where they've been, I get their maybe skepticism sometimes that how is this going to be different? But when they see that there's something happening that has never happened before, something being put together or worked on an area in the abdomen that never been worked on before this way, and they become not only shifting physiologically, emotionally, and shifting other things in their life, which they tell me about, maybe their other stresses, career or life doesn't become as stressful anymore, career, then those are the lasting changes that you really want to see. You're not just seeing something for 2 days or 2 weeks get better, but you're actually seeing a lasting transformation.
Yeah, it's like this kind of chicken and an egg thing. Yeah. We have stress resulting in pain, and then pain resulting in more stress. You resolve one, and then there are changes. It's cascading. Yeah, I see that in my practice too. You resolve an issue for someone, and then it has unintended consequences throughout their life. And that's really nice. It's like, okay, everything is opening up now. Yeah. Now that I'm feeling better, now that I'm responding to people differently, now that I'm responding to stress differently, there's so many changes that happen throughout the life that it's really rewarding.
Yeah, that's what we want. We want to empower people. I know as healers, as working here, we I know you and working with is you just want to get people's energy up. You want to get them in a better place. You want to get them to where they're empowered, and that's the key. So.
Oh, absolutely. And taking care of themselves and being responsible for their emotions and being responsible for their thoughts and being responsible for their energy, minding their energy. It's all one. All roads lead to Rome.
Mm-hmm.
Yeah.
Yeah, exactly.
Everything is connected, and so whatever people resonate with, that's what they're going to stick with. And, people resonate with massage, people resonate with energy work. So there's all kinds of different ways to get the same type of results, which is great. So, however that works for people. And I love that, we're in a city where there's so many different resources and there's so many different practitioners. There's so many different, even education. There's UMKC Medical School, there's KU Med, and they're starting to maybe become aware of what we're doing.
Yes.
Yeah, I know I have people from those that I'm working with from those avenues. So
people are starting to ask a little more questions too, and like I said, it's about educating people, and people will hear how people are responding to different treatments and what you're doing, and how those medical facilities can use it, and they want to know because their patients are asking for it. Patients are asking for options and things like that too. And they feel the frustration too sometimes that any physician too really wants to spend more time, and time's prohibited sometimes too.
It is only with our current system.
10 minutes or 15 minutes, even the best doctor in the world has the best heart and best intention. It's hard to solve anything with that.
Exactly.
And so it's the first time I work with someone, it's 2 hours. You have to be able to see.
You have to.
2 hours to know the person, to treat the person, do all that. And then a follow-up is going to be an hour and a half usually because of that. And this is the time that it takes to really know the person, to get the person. Because even if someone's coming in for, let's say, an acid reflux condition, which seems to be a very simple digestive thing, we normally would treat it with, like, say, an acid blocker or something to get that too. But on a physiological standpoint, that diaphragm is contracting. Something caused it to contraction against that pyloric sphincter. So physiologically, we can unwind that and take care of it. But it helps to really spend the time to talk or listen to the person and say, when did this happen? When did you first have this? A few years ago. What happened in your life?
Exactly. What was going on in your life when
did you change jobs? Did you move across the country? Did you go through a divorce? What may have happened? Or, those things contract. And so just by asking that question or getting the person aware of it, you can see that their spirit is really happy. They know that, there is a connection. It activated that for a reason, and I can actually, let go. And that's what helps us sustain those effects for a longer period, because it empowers the person to go, it's not just me. There's a reason for it.
Right.
There's a reason for it.
Right.
And that awareness is healing, which brings it back to, I'm aware of it. I can heal from it.
Right. Absolutely. Okay, well, I've really enjoyed talking with you. I think we're out of time. So if somebody wants to get in touch with you, we'll put your contact information in the show notes. Do you ever do anything remotely?
I can do some talk remotely, yes, as far as as far as coaching, guidance, things like that too.
Terrific. So, yes. Oh, that's fantastic.
And
for people who are, maybe clients, but also for people who would be interested in practicing.
Yeah.
And learning more about what you do. That'd be fantastic. Thank you so much for sitting down and talking with me.
Welcome.
It's always enlightening for me to find out. It's a lot of fun to sit down and talk about what you do, right? And get to know more about traditional medicine, abdominal massage. So it's been really enlightening. And thank you so much.
Thank you. Thanks for having us.
Yeah, absolutely. Certainly.
Radiate Wellness is a community of holistic and alternative healers and consultants based in the Kansas City area, dedicated to helping you create spiritual, energetic, and physical well-being. To learn more about our practitioners, services, classes, and events, or to schedule an appointment, Visit us at radiatewellnesscommunity.com.